This is America Daily, bringing you the best in truthful news updates and in-depth reports happening now. Welcome. This is America Daily. I'm Mark Jackson. A growing number of children in the United States suffer from chronic illnesses. According to a 2011 health survey funded by the U.S. government, 54% of children have one or more chronic health conditions. Asthma is the leading chronic illness in children, according to the American Lung Association. About 6 million children under the age of 18 suffer from asthma. Other chronic health conditions include allergies, ADHD, autism, and food allergies. A number of parents are turning to more holistic medicines like acupuncture and Chinese medicine to help treat their children. Today, we explore some of the chronic conditions that children can be treated for. We hear from a licensed acupuncturist about how this ancient practice can help children heal more naturally. Here to tell us more is Mei-Ling Li.
I sat down with Nancy Bierma to talk about pediatric acupuncture, one of the specialties in traditional Chinese medicine. Nancy is a licensed acupuncturist in Minnesota. She is a clinical supervisor in the acupuncture teaching clinic at Northwestern Health Sciences University. She also practices at Woodwinds Natural Care Center and has been in private practice since 1998. I would like to make a disclaimer before we continue that this episode is for informational purposes only and is not a substitute for professional medical advice. Nancy, it's wonderful to have you at America Daily.
Hi, thank you for having me.
Acupuncture in Chinese medicine has been used in China for thousands of years to treat various childhood ailments. But in the U.S., the idea of treating children with Chinese medicine is still relatively new, even though adults are doing it more often. Most parents don't think that there are alternative treatments besides going to their doctor and getting prescription medicine. So, what health conditions in children can be treated by traditional Chinese medicine?
Well, surprisingly, you can treat most things that children have as their issues or their health problems. I've treated everything from very complicated children that were born with genetic disorders, and parents are hoping to just advance that child and to help that child develop to their very utmost, as well as simple things that everybody has issues with, like colds and ear infections and sleep. Lots of people come for babies that won't sleep. That's a common one. There's lots of things that are common in children that you see all the time.
Is acupuncture in Chinese medicine safe?
It is. It's very safe. As long as the acupuncturist is well trained and is a licensed acupuncturist here in Minnesota and has a knowledge that they're, comfortable with and they've worked with children, then it's very, very safe and effective.
Parents may be concerned that acupuncture is painful. Does it hurt?
It hurts way, way less than anybody thinks it's going to. I try to make it painless, and I use very, very thin needles. The gauge of the needle will really matter, as will the technique of the acupuncturist who's inserting them. Some people are aggressive and some people are very gentle. I am on the 10 out of 10 gentle scale, which is just how I choose to practice and the needles I choose. It's something you can always investigate with your acupuncturist and ask them to use a thinner gauge or whatever if it's something that you have experienced that was painful. But it should, occasionally it's going to feel a little discomfort or maybe like a mosquito bite, but it also may not hurt at all. And once they're in, it doesn't hurt.
What if a child has a strong fear of needles?
So here's where the finesse comes in. I do some teaching at the acupuncture school, and I tell the interns that ask about this, you can teach the medicine, maybe the skills with children and families is something that is better if you have a background with children or if you want to spend some time with children, because that's the sort of tricky finesse part. You have to be a kid person and willing to charm them and get everybody comfortable in the room and then see where the boundaries are. I think, where are the boundaries with the parent? Where are the boundaries with the child? If a parent or a child just absolutely is going to not be okay with needles, then I use other modalities, tuning forks, my hands, beads, magnets. There's all kinds of things that I use besides needles. But if a lot of children are comfortable with needles, and surprisingly, I can usually pop a couple in without the child kind of recognizing it, which always kind of dazzles parents. They're just surprised to see a needle in the top of their child's head because the parents are often more frightened than the children, actually. So it's just finessing it and doing what the comfort level is with that family and with that child. And the age really matters too.
From your experience, is there a certain age that children should not get acupuncture?
Some people will tell you that that's true. I have not done that. In my practice, I'll treat a newborn, I'll treat any age, and again, use my own knowledge and judgment as to what that looks like. So a baby and a early toddler is easy to treat because mom can just hold them and they're kind of just along for the ride, and they really let you do basically anything you want to do. Sometimes they cry, but it's a baby. They cry anyway, right? And then the trickier age is when they get old enough, like maybe 4 or 5, where they're very opinionated. That's where you start to have a little more trouble. So it's actually very easy to treat younger children. It gets trickier, and then it gets easier again because then you can negotiate and explain, and they start to say, well, okay, I'll try one. So it just kind of varies with the child, but it also, the age group that I would say is the most needle phobic is the children who have had vaccines and they know about needles and they see you as a doctor and they sort of say, okay, no, you can't do that. But you can still win their trust. It takes sometimes more than one treatment.
Are there adverse reactions parents should be concerned about with acupuncture and Chinese medicine?
I haven't seen anything adverse. It's really in the category for adults and children that it might not help, but it probably is going to help. It's not going to hurt. So I tell people, this isn't going to hurt and it'll probably help. And I think that's true with 0 through 120 or however old you live to be. You can always try it. And if it doesn't work, you haven't lost anything. You're just healthier because you did it. So I think that's true for children.
Are there any conflicts or concerns for children to take Chinese herbal medicine if they're on Western medications?
So a couple of things. We are always partners with the Western medical community and not trying to diagnose in their system, we diagnose in our system. So the first thing you want to do is refer when there's any doubt or any question mark, and then work in conjunction with that. Once they are on a medication, though, often the parent's goal with the doctor and their family is to reduce the medications or to get off some strong medications. So a lot of times when someone comes for acupuncture, they are trying to become more holistic with their treatment. So you're working with the family, with the doctor, with the child to do that. And so that's the goal. Otherwise, though, there's another caveat to that, is that there is a website where I can enter information about medications and herbal medications and see if there's contraindications. So you can enter. This works great for adults too, because they really always have all these conflicts that haven't been discovered. So we're kind of good at that too. So you put all the medications in and you put your herbs in, and then you find out that the conflict is actually in the medications they're taking, not with the herbs. But that doesn't always happen, but it happens a lot. So you're able to look at that analysis and make sure that you're not canceling something out. But it's actually a lot easier with children because they're usually not on too many things and the herbs are fine with it.
How long does it take before parents can see improvements in their child's condition if they came to you for a treatment?
That's so individual. It's very hard to say, but children do recover quickly. Their little bodies want to heal, and it's great to treat children because let's say that someone has headaches when they're 10 years old. You can correct those headaches pretty quickly when they're that young, and you can change the pattern in their body that's causing the headaches, and you can give them tools so that they know how to take care of a headache the minute they get it. If that same person has had headaches for 20 years and they come to you when they're 30, it's not that you can't help them, because you can, but it's a longer, more ingrained pattern, and it will take longer to switch that around and help their body to heal from that than it would have if they came when they were 10. So it's always, how long have you had the problem? How severe is the problem? How chronic is the problem? You're analyzing all of that, and then you can give the person an idea of how long it might take to work on this, but I don't usually give timelines. I know most acupuncturists do, but I learned early in my career that I will work with somebody for as long as they want to work on something. And I don't ever say 10 treatments and you're done, because quick story, I had a woman who had headaches. She came for a year. I thought we were never going to make any progress. This was real early in my practicing. And I thought, people have told me at 12 and you're done, or 15 and you're done, or 20. And I thought, I don't think she's ever going to get better. This is all in my head. And I remain very optimistic about healing. I always think everybody's going to get better. And she was the one who said, no, I want to keep coming. Everything else is my sleep is better. Everything is better about me. I'm feeling better. My energy's better. My headaches will go away. And after, I think it was 18 months or 2 years, she called me. She said, my headaches are gone. And I said, what? I don't believe this. Just all of a sudden they're gone. She said, yep, thank you. They're gone. I said, no, you have to keep coming. Now I'm nervous. So she came about 3 or 4 more times and she said, I'll call you when they come back. She didn't call me for 6 months or a year. She said, yeah, they're gone. So it just taught me, if I had cut her off, if I had said, no, I think 12 treatments, I think 6 months, she would not have fully healed. But she knew enough to teach me that the person heals when they heal. And sometimes it's very quick, and children are a lot quicker than that. But sometimes it's very quick in children, and sometimes it takes a little longer. It really depends on how their body responds, which is not my decision, apparently. I'm the conduit. I'm the helper. I'm not the master of that.
Now I'd like to shift gear and talk about several common ailments that kids suffer from. I have kids of my own and noticed that when they were younger, they often got sick when seasons started to change. From my research, it seems parents don't need to wait until their child gets sick before bringing them to get treatments, since traditional Chinese medicine is preventive medicine.
Change of season is a great time for anyone to come into a clinic and get acupuncture, especially children, because they're returning to school. They're around a lot more pathogens, just being in the little cesspool of their elementary schools and their middle schools and their high schools. So it's a good time to come in for stress relief coming back to school. It's a good time to help your lungs become stronger for the fall season, because we have theories that involve what organs like certain seasons and dislike certain seasons. And it's very hard on the lungs in the fall because it becomes drier and the air is, getting colder. And those are the things that irritate the lungs sometimes. So people tend to get more colds because they're around colds, and they tend to have more flare-ups with maybe their allergies or their asthma, or just a little depletion of those systems. So coming in for acupuncture for children, just like adults, can help to strengthen those and can help you to also get help with common cold, or if you're actually sick, you can always call your acupuncturist or take your child in, because there's some herbs and various things that can help the runny nose or the stuffy nose or the cough, whatever you're dealing with.
Are there things that parents can do themselves?
There are. I would say that the best plan, though, is to make an appointment with an acupuncturist, because self-medication is tricky. I can speak from personal experience that before I went to acupuncture school, I used to go to the health food store and buy all this stuff and give it to my kids and give it to myself. And once I started to actually learn the details of herbal medicine and how many elements there are in it, of some are hot and some are cold and some match you this way and some match you that way, I realized that I wanted a trained professional to be telling me what to take and me not just guessing. So really it's best if you can have advice from someone and they can tell you things that will match your situation, your child's sort of predisposition to whatever it is that bothers them, or maybe they always get a certain kind of flare-up, and your acupuncturist can tell you foods that might help that, or herbs that they can take, and they can give you prescriptions for herbs or tinctures. If they're young, the little liquid tinctures is what kids need. So it's always a good idea to get the full intake and then get your herbs prescribed so you don't guess the wrong thing. It's not going to hurt you. It's not going to kill you or anything, but there are some theories in Chinese medicine of if you have phlegm and you kind of took the wrong thing, you could make the phlegm stronger. And you just, it's better to consult with somebody. And then once you get someone you trust, maybe you can just know, oh, this happens in the fall and we can do this, or you can give them a call or whatever. So there's a lot of options.
How successful is traditional Chinese medicine in treating cough and cold?
It's very successful. You're not going to, I think the thing that is hard to explain with Chinese medicine in general is that people are used to Western medicine. I have a headache, 2 hours later, my headache's gone. So I always explain that Chinese medicine works in a different way. It can make the time and length of the cold shorter. It can help with the severity of the cold. You're still going to have a cold, but it really can reduce the symptoms and the length and the severity and all of that. So seeing your acupuncturist or taking your child in is a really good idea, because you might be dealing with 5, 6, 7 days rather than 2, 3, 4 weeks of coughing and hacking or whatever. And if you do have the lingering, there's also, we change the herbal formulas according to what the symptoms are. So at first you got a sore throat, there's something for that. Then later you can have something for cough. Later you can have something for, whatever's going on, if there's wheezing or whatever lingering. So there's different treatments for different phases as well. So that's why it's good to have an acupuncturist to consult.
Let's talk about chickenpox. Can parents bring their child in for treatments?
Chickenpox is interesting because kind of like nobody has it. It's just like I haven't had any kids come in with chickenpox, but that's a whole other story because of the vaccine for it. But then there's parents who are still trying to have it, happen naturally. But honestly, a lot of things like that, people don't even think to bring their child to acupuncture because it seems like a Western problem. It seems like, I just need to consult my MD for, why would an acupuncturist want to see this? But honestly, in the traditional sense from China, all of these things were treated, and there's, ways to help the body heal from it and shorten the length and shorten the severity and just recover better.
What about constant ear infections?
So constant ear infection, here's the at-home tip. My business partner and I had a pediatric clinic from 2009 to 2015. We did close that specific clinic because she had 2 kids right in a row and didn't have time to devote to the other kids, but she'll be back. And we joked that we made most of our money by telling people to eliminate dairy. So the first thing you're going to do if a child has chronic ear infections is get the dairy out of their diet. So that's something that people at home can do. That's a big culprit for lots of things. And if your child does get sick with a cold, I didn't mention this before, but just even if they are fine with dairy most of the time, eliminate the dairy during the cold because dairy is known to produce more phlegm. So if you're eating a lot of dairy, your body is producing more phlegm. And if you have phlegm in your ears, which is basically what we kind of call that stuck goo that's in the ear infection, it's going to not help the situation. Same with kids that have cold, they're going to be producing phlegm all of a sudden, and you don't want to be adding to that. And constipation as well, I might say. Eliminate the dairy if your child has constipation. And I mean eliminate all dairy. It's funny that people think that just means cow's milk and not yogurt and cheese and other things. So you do have to kind of think through exactly what does have cow's milk in it, and maybe switch to almond or coconut or whatever your child likes for the yogurts and the milks and stuff. And if the child doesn't have any kind of chronic problem, you can go back to it once the, cold is over or whatever. But if they do have chronic ear infections, I would suggest eliminating it. That also goes for asthma and eczema, by the way. But that is often an irritant.
How often do you use food therapy in your treatments?
Food therapy freaks people out. So people come in and you start changing their diet. The parent instantly starts to, now this isn't all parents, because I'm sure some people out there are like, I love food therapy. I love to cook, but there's kind of a 50-50. And this is where you have to read your family. And if someone's really interested in food therapy, you can give a lot of suggestions right off the bat. But if they're a person who maybe has a really busy life and they are really stressed out already by their child only eating 5 things or something that is unique to their child, You can take baby steps. So food therapy is part of our medicine, but I wouldn't want anyone to be scared to go to the acupuncturist because they think it's going to be all, upset the apple cart. You can't have dairy, you can't have gluten, you can't have anything, because I think people feel a lot of pressure these days, just all the allergies that kids have, and they hear their neighbor talking and their friends at school and whatever. And that's all very real. Children are becoming more sensitive, but you have to work with each child and family where they're at for that. But food therapy is a good thing. And there are general tips too, like I said, with the dairy, or, pears are good for lungs, or, things like that people can adapt to very easily.
Minnesota has one of the highest confirmed cases of Lyme disease. Do you see a lot of patients with Lyme disease?
So yes, we see a lot of Lyme disease, but it doesn't seem like as many parents come in with their children for Lyme disease as some other things. So I don't think there's been a lot of education and awareness that is something that could be really, that could be something that we could really help with. I have seen a lot of young adults, maybe high school, college, and older, of course, and particularly in my adult part of my clinic or my teaching at the acupuncture school, there's a lot of people that have had Lyme's disease. So you're working with the joint pain and the issues that go along with that become chronic. And I think we'll see more children coming in with that in the future because it's becoming more aware, and it's hard to diagnose too. So I think that functional medicine is a great partner for us. I am always an advocate to send my patients for further testing with good chiropractors or naturopaths, or there's a great place in Edina, Restorative Health Solutions. I send people to get their blood work and get their diagnosis from those folks because they can really help pinpoint and give they can really help pinpoint and give good solutions along with what I'm doing. So acupuncture is great, but when it's not enough, then we have partners that help us.
What are the most common health conditions do you see in your practice?
So the most common things off the top of my head for really young children is sleep problems. Constipation is huge in children, really a lot of ages of children, but I would say 12 and under, but particularly young children because it can be a real problem in a baby. And skin issues, like you mentioned, eczema and also asthma. And those two often go hand in hand, by the way. So parents, if your child has eczema and constipation, come see an acupuncturist. And the headaches as they get a little bit older, lots of anxiety in children that are in school, particularly once they get a little bit older. I see a lot of upper elementary, middle school, high school kids that have depression or anxiety. Life gets kind of hectic for them. And did I say for that age group also headaches, menstrual problems, different kinds of things as young women, get a little older, as young women get into middle school and high school. And then ear infections, as you mentioned before, is common for young children. I'm sure there's more. I'm trying to think. There's a lot of things that are common. And then there's the things that aren't common, which are interesting too,
And what are some of your most difficult cases you treated?
Well, I think that children with autism is often, it's not difficult. It's just that it's a condition that's not necessarily going to go away. So what people are wanting is a big improvement, but what you can actually offer is help with the specifics. So in other words, if a child with autism has sleep issues, you can help with the sleep issues. Or if they have a severe anxiety, you can help with the anxiety. So I think that sometimes sorting through that and helping the family to understand what you can do for that child takes some education, which is what we're hopefully doing today. It's great to educate parents about all the things that acupuncture and Chinese medicine and herbs can do to help, even if there's a condition that's not going to necessarily go away. But I've had some really specific genetic disorder cases that are difficult, but also some of my favorites. because it's fun to adventure with someone and try new frontiers. I have one family that I dearly love that come regularly. Their child has a very rare condition and has had some seizures, mild seizures though, and different things developmental things. And she believes that it helps. And we work together, sort of new frontier. I've never worked with a child that had this condition because it's so rare that you wouldn't see it. But I'm honored to be able to help this child to their fullest potential. That's what we want to do with anybody. So it doesn't matter. You meet them you meet them where the condition, you meet them where they are and work with the condition and make the best progress that you can for that person, whatever that means. It's the same as if someone elderly has a chronic condition and it's, we do say in Chinese medicine, if it's completely broken, you can't fix it. If they have, a spine that's curved and is painful, you can't make that spine go straight again, but you can just work with quality of life, try to help that person to have the best days they can have. So no matter who the person is and how old they are, you want to work with their conditions and their issues and help them to find relief and have the best days they can.
Before we finish up, Nancy, do you have any final words?
Well, thank you so much for asking me to talk about, I love to talk about acupuncture. So thank you very much for letting me talk about acupuncture and pediatrics and herbal medicine. And I hope that everyone learns something and is willing to explore our wonderful medicine.
Nancy, thank you for being with us at America Daily.
Thank you.
And if you would like to know more about how acupuncture and Chinese herbs can help treat childhood diseases, you can visit Nancy's website at nancybierma.com. Thank you for joining me at America Daily. I'm Mei-Ling Lee. Until next time.
This is America Daily, bringing you the best in truthful news updates and in-depth reports happening now.